Thank you, Mr. Chairman. Mr. Chairman and members of the subcommittee, I'm pleased to be here today as you continue your oversight of DoD and VA efforts to improve health care and other services. As the situation at Walter Reed came to light earlier this year, the gravity and implications of many long-standing issues became clear. I visited Walter Reed last month, as I know many of you have, and learned firsthand from some of the soldiers there just how far the system still has to go. I am pleased to be joined by my colleague Dan Bertoni, who leads our disability work at GAO. Mr. Chairman, I would like to ask Dan to make a few comments because he's our disability expert. I'll provide an overview first and then turn it over to Dan to focus on disability.
That's fine, thank you.
Please take note that the findings that we are presenting today are preliminary, based in large part on ongoing reviews. Much of the information is literally days old, and the situation is evolving rapidly. Efforts thus far have been on two separate but related tracks. First, I will cover the Army's service-specific efforts. Then I will cover the collective DoD-VA efforts. The Army's focused on its issues through its Medical Action Plan. The centerpiece of that plan is the new Warrior Transition Units. The Army formed these to blend active and reserve component soldiers into one unit and to improve overall care for its wounded warriors. While these units have been formed on paper, many still have significant staff shortfalls. As of mid-September, just over half of the total required personnel were in place in these units. However, many of those personnel that were in place had been borrowed, presumably temporarily, from other units. Ultimately, hundreds of nurses, enlisted and officer leaders, social workers, and other highly sought-after specialists, like the mental health professionals that will help with TBI and PTSD, will be needed. The Army told us it plans to have all the positions filled by January 2008 and is planning to draw these personnel from both the active and reserve component as well as from the civilian marketplace. Filling all the slots may prove difficult, as I think everyone knows the Army is stretched thin due to continuing overseas commitments. Furthermore, the military must compete in a civilian market that will pay top dollar for many of these health professionals. This is an area we intend to monitor closely as we continue our work. Now, if I could, I'm going to briefly describe the broader efforts. Through the newly created Senior Oversight Committee, DoD and VA are working together to address the broader systemic problems. One of the key issues being taken on by the Senior Oversight Committee is improving the continuity of care for returning service members. In plain English, this is about helping the service members move from inpatient to a less regimented outpatient status and navigate within and across two entirely different departments, DoD and VA, as well as possibly out to the private sector to obtain needed care. This can be quite complex. To improve continuity, the Dole-Shalala Commission recommended that recovery plans be crafted to guide care for seriously injured service members, and that senior-level recovery coordinators be put in place to oversee those plans. DoD and VA intend to adopt this recommendation, but key questions remain unanswered. For example, it is unclear exactly which service members will be served by this recovery coordinator, and without an understanding of the proposed population, it is impossible to understand answer other fundamental questions, like how many recovery coordinators will ultimately be needed. It is also unclear how the Army's efforts will be synchronized with the broader efforts. This is important so that service members do not have too many case managers, potentially resulting in overlaps and confusion. Mr. Chairman, given the complexity and urgency of these issues, it is critical for top leaders to ensure the goals are achieved expeditiously. However, careful oversight will be needed to ensure that any gains made in the near term are not lost over time. That concludes my part of the statement. With your permission, Dan will focus on disability issues.
Thank you, Mr. Pendleton. Mr. Bertoni would be anxious to hear from you.
Good morning, Mr. Chairman, members of the subcommittee. I'm pleased to be here to discuss an issue of critical importance, providing timely, accurate, and consistent disability benefits to returning service members and veterans. Thousands of Operation Iraqi Freedom and Operation Enduring Freedom service members have been wounded in action, many of whom are now trying to navigate a complicated labyrinth of disability policies and often wait many months and even years for a decision. The various Commission reports have noted that overhauling the disability evaluation process is key to improving the cumbersome, inconsistent, and confusing bureaucracy facing injured service members. My testimony today draws on our ongoing work and focuses on three areas: current efforts to improve the evaluation process, challenges to reforming the system, and issues to consider as DOD and VA press ahead on this important matter. In summary, our prior work has identified long-standing weaknesses in DOD's and VA's disability programs, especially in regard to the timeliness, accuracy, and consistency of decisions. More recently, an Army Inspector General report noted similar problems with DOD's system, including a failure to meet timeliness standards, poor training, and service member confusion about disability ratings. In response, the Army developed several near-term initiatives to streamline processes and reduce bottlenecks, such as expanding training, reducing the caseloads of staff responsible for helping service members navigate the system, and conducting outreach to educate service members about the process and their rights. To address the more fundamental systemic issues, DOD and VA are also planning to pilot a joint disability evaluation system. The agencies are currently vetting multiple pilot options that incorporate variations of 1, a single medical exam, 2, a single disability rating performed by VA, and 3, a DOD-level evaluation board for determining fitness for duty. However, at the time of our review, several key issues remain in question, such as who will conduct the medical exam, how the services will use VA's rating, and determining the role of the board. DOD and VA recently completed a tabletop exercise of 4 pilot options using actual service member cases. Where preliminary results showed that no single option was ideal, officials told us they were currently analyzing the data to determine which option or combination thereof would be most effective. Although the pilot was originally scheduled for rollout in August 2007, this date has slipped as officials continue to consider these important issues, as well as various Commission report findings and pending legislation, which could in fact affect the pilot's final design and implementation. Beyond pilot design issues, DOD and VA face other challenges. 3 of the options call for VA to conduct a medical exam as well as establish the disability rating. This could have substantial staffing and training implications at a time when VA, with 400,000 pending claims already, is struggling to provide current veterans with timely and quality services. We're also concerned that while having a single rating could improve consistency, VA's outdating rating schedule does not reflect changes in the national economy and the capacity of injured service members to work, thus potentially undermining the reintegration of returning warriors into productive society. Going forward, DOD and VA must take aggressive yet deliberate steps to address this issue. Key program design and policy questions should be fully vetted to ensure that any proposed redesign has the best chance of success. This will require a careful, objective study of all proposed options and pending legislation, comprehensive assessment of pilot outcome data, proper metrics to gauge progress of the pilot, and an evaluation process to ensure needed adjustments are made along the way. Failure to properly consider alternatives or address critical policy details could worsen delays and confusion and jeopardize the system's successful transformation. Mr. Chairman, this concludes my statement. I'm happy to answer any questions you may have.
Thank you very much.